figured you'd
Hey,
just
Dr.
do what
Steve.
you wanted.
Here we go.
It's Donna Bell.
Hey.
Hey, Donna.
My question is, how does cancer actually kill you? Especially something like skin cancer. So it spreads. So what? Let me know. Thanks.
Yeah. Okay. Well, first off, you ready for the 3 minutes?
Already started.
Okay. So there's several different kinds of skin cancer. There's basal cell skin cancer. There is squamous cell skin cancer, and then there's melanoma. Now, melanoma kills you by invading organs and making them not work, and by robbing your body of nutrients, because it's selfish. It's just, making itself grow, and it takes blood supply and nutrients for itself. Now, I have seen both squamous cell cancers and basal cell cancers finally take somebody out. If they let them grow long enough, particularly if they start on their face.
Gotcha.
I've seen it where the basal cell skin cancer, which we usually think is pretty benign, they just grow, but they will continue to grow. They'll never stop. Grew over somebody's carotid artery in their neck until it ate through it, and then they bled out, and that was the end of that. I've seen squamous cell cancer invade the orbit of the eye, and that's an issue as well. So, but in general terms, cancer kills you when it becomes in the later stages, affecting the ways that your body actually functions. It can get into your brain and cause disruption of function there. They can get into your lungs, your liver. A lot of times, if it gets into the liver, you'll eventually get liver failure, and then you die from liver failure, et cetera, et cetera. You stop eating because these things secrete hormones that make you not want to eat, or the treatment does that, and you just end up fading away. And then something else kills you, like pneumonia or urinary tract infection or something that makes you more vulnerable to other things killing you. So it's any of those things. Anything you want to add to that?
No, I agree 100%. Yeah. Uncontrolled cellular growth, cancer, just keeps sucking away all your nutrients. Too.
Eat shit, cancer. How about that? I'm sticking my neck out.
Agreed.
Yeah, I think I'm taking a stand that's unusual. All right, you ready?
Yeah.
Hello, Dr. Steve.
Hello, friend.
How do I remove PFAs, PFOS?
Yeah.
All kinds of PFAS related and BPA related chemicals from my body.
Sure.
Thank you for your time.
Thank you,
Have
my
a great
friend.
day.
So
great week.
Thank you, and you as well. So there are these perfluoroalkyl substances and also polyfluoroalkyl substances. There's millions of chemicals. They make grease and water resistant products and food packaging and clothes and all over the place, and they stay in your body and in the environment for years and years without breaking down. When you were a kid, you and I did anyway, ran through the clouds of DDT, and apparently that's still in my body. So you and I have talked about toxins, and everyone talks about toxins, and some of that is bullshit, but there are real toxins, and this is one of them. They're trying to limit this PFAS contamination, remove it from drinking water, and once they get into your bloodstream, there are fewer tools to remove them. But there is a simple over-the-counter medication if you're really worried about this. If you've been highly exposed to these things and you're worried about it, you could take a drug called cholestyramine. Now, GBAC was on that. He took it for post-cholecystectomy syndrome.
Diarrhea from
That's right. So cholestyramine was initially marketed as a cholesterol drug. It would sequester fat on its surface, and then you would evacuate it through your bowels unabsorbed. Also, it can absorb other things as well, and it causes constipation too. So we have people with chronic diarrhea will use cholestyramine for that. But this has been shown after taking cholestyramine for 12 weeks in this randomized clinical trial, 45 people in Denmark who had a high concentration of PFAS in their blood. After 12 weeks, it dropped by an average of 60%.
Wow.
Now, that's not some namby-pamby bullshit response. We'll do things in medicine for a 5% improvement.
Shit, yeah.
But 60% improvement, that's just over 6 weeks. So it's going to be a curve, right? So the first 12 weeks you may do 60%, and then the next 12 weeks you'll do 60% of that. So you may have to take it for a year, but you may be able to eliminate most, if not all, of these chemicals from your body using this stuff. So very interesting. And it's the number one thing, though, is we got to get these things out of our food supply.
Right.
It's great that we have a pill that we can take for it, but that doesn't eradicate the need for us to do something about this. So, all right.
You have 19 seconds left.
All right.
On
Well,
that
I'm going to reclaim my 19 seconds for this next one. All right, Dr. Scott, before we get out of here, let's do one or two more, and then we'll check in with the Fluid family in the waiting room.
Yes. Hi.
Hello, my friend. How are you?
My name is.
We don't need to know your name. Okay. All right.
And
there we go.
I have what is called sinus tachycardia.
Sinus tachycardia.
I'm sure you guys are familiar with it.
Yes.
Can't seem to get it under control.
Okay.
Work out daily.
Okay.
And it feels great.
Yeah.
But it still comes on, and when it comes on, it's hard.
Now, the interesting thing is he says it comes on. So there is a thing called inappropriate sinus tachycardia. These are people that have a heart rate of greater than 100 all the time. And it's not caused by a medical condition or any sort of physiologic reaction or anything like that. Really not even caused by medications. And they get dizziness, palpitation, shortness of breath, stuff like that. And it is thought to be caused by an abnormality in the pacemaker of the heart, which is in the right atrium, but they just don't know. And some people don't ever have any symptoms, so there's not a lot of research been done on this. But it will get worse in the presence of caffeine, nicotine, spicy foods, probably marijuana, because it tends to cause tachycardia in a lot of people. Red meat, alcohol, deli meat, that kind of stuff. And they recommend generally increasing the intensity, but he's already exercising.
Mm-hmm. Yep.
And they even say yoga may help to improve sort of what we call vagal tone on the heart, where you can slow the heart down by yourself through deep relaxation, like some of the yogis were able to do. But really, this guy's saying that when it comes on hard. That sounds more like a paroxysmal atrial tachycardia or even paroxysmal atrial fibrillation. So I know that he told me a sidebar that he'd had a monitor placed.
Okay.
But what he needs is not a Holter monitor. He needs an event monitor.
Mm-hmm.
So a Holter monitor will record all your heartbeats for 24 to 48 hours,
Mm-hmm.
and then they download. Well, what if it doesn't happen?
Right.
So, but if you wear an event monitor, then when he's talking about, hey, it's coming on hard, he can push the button.
Mm-hmm.
It will record the 30 seconds before and then the next minute.
Okay.
And then they can look at those and say, what's going on? Is it just sinus tachycardia? Is it something else going on? So that's how I would handle this. Because he has episodes, I would want to make sure that he doesn't have an episodic cardiac problem.
Mm-hmm.
Okay.
Yeah.
Right.
And I would say this too, if he has his episodes and it's coming on hard, to try a vagal maneuver, like a hard cough.
Yep.
Sometimes a deep hard cough will help to slow a heart rate if you've got sinus tachycardia, if that's what he's got.
Yeah. Well, that'll definitely stop. Well, may stop a paroxysmal atrial tachycardia for sure, and the diving reflex too.
Diving reflex, yep. Or even sticking your face in a bucket of ice cold water.
Well, that's what I was. That's how we did it.
Yep.
Well, we used to do it in the CCU all the time, and people with these paroxysmal. We'd ask them first.
Yeah.
And we'd bring in you want to try something?
Mind if we waterboard you?
Yeah. And we'd get a big bucket, of ice water, and just mush their head in it. And when they would do it as long as they could, when they came up, very often their heart rate would go back to normal. So.
Right on.
All right. You got anything from the fluid family?
Let's do one from the fluid family and we'll wrap it up.
Okay. Well, do we only have one?
We have Typhoid Mary in here.
Okay. All right.
Renee, she's brand new to the crew.
Okay.
She wanted to ask a question about fluoxetine.
Okay.
She said,
or as Governor, what's the guy's name? The wrestler that was governor of
Jesse Ventura.
Yeah. Oh, fluoride is it's an ingredient in Prozac. It's an ingredient in Prozac. So his postulate was that they're putting fluoride in the water, so they're trying to pacify the population. But it's not an ingredient. It's not a cake.
No.
It's a molecule, and the fluoride. The fluorine is there to draw electrons away from the other side of the molecule because of a very strong, electron attractor, and to expose the other side to be more active. So anyway, yeah. There you go, Jerry.
There you go. So
Jesse,
Jesse. So Renee's on fluoxetine, and she says that anytime she Googles it, it looks like there's no other medications or anything she can take with it because everything's catastrophic. So there are a lot of medications that have really serious side effects if you take in conjunction with her fluoxetine.
Yeah, that's the problem. Does she have examples of that? Because fluoxetine is a serotonin reuptake inhibitor, so it increases the levels of serotonin. So you can't take it technically with things like trazodone, which also does the same thing, fentanyl, those kinds of drugs.
The only thing she added was that if for instance, like an NSAID or prednisone, which can cause gut bleeds, if mixed with fluoxetine, but I'm just going to tell you, they can cause this anyway.
Those are relative contraindications.
And they can happen even if you're not taking fluoxetine, taking NSAIDs, or warfarin, blood thinners, prednisones. All of those medications can thin the lining of your stomach.
Yeah,
cause gut bleeds.
The main thing with fluoxetine is serotonin syndrome. Taking, like I said, fentanyl, lithium, tryptophan, Buspar, things that increase levels of serotonin as well. Those are the really big the big precautions. If she doesn't,
benzos, right? Want to make the benzodiazepine stronger? Is that right?
How many people do you know that are on an SSRI,
a lot,
a Buspar, and a benzo?
Yeah, you're always worried about benzos just making people sleepy, but there are other drugs like Meloril, which is thioridazine and stuff like that you don't want to take. Amphetamines, St. John's wort is one. So but as far as some of these other things, if they're relative contraindications, then you got to weigh the risk versus the benefits. Now there are other antidepressants out there as well. If fluoxetine's presenting too much problem for you, and very soon we're going to have non-serotonin type of antidepressants out there. Well, there's already one, which is buspirone.
Okay.
Bupropion is Wellbutrin, and it works on a different axis. And what about Trintellix? Did it work on a serotonin axis as well?
Yeah,
it did. Okay, but it had some other mechanisms that were different.
Well, it hit 5
different serotonin
receptors.
Got it. Okay, very good. So that wouldn't pose,
I think it was 5.
Too much of an improvement, but there are other things. We're going to have psilocybin based antidepressants soon. Ketamine is already on the market. I'm not suggesting that she do any of these things, but she could certainly talk to her provider about.
I think the main thing about fluoxetine is the side effects.
Yeah.
Excuse me.
All right. We got super chat from the Bedabbler Network. Thank you for being the MVP of Hackamainia. That's bullshit. I bragged to people I shared a stage with you. Well, I bragged that I shared a stage with you. So, but the Tukey is everyone's favorite.
Isn't it just a love fest?
Yeah, but with you, but even more that I call you a friend. Likewise, my friend. LYOLYMTAF. Love you more than a friend, Dr. Steve. Likewise, my friend. One of the sort of positive things about this Hackamainia was meeting new friends. There are people that, and solidifying friendships that we already had. Like Rocco and I have hung out some together, and we did in Largo, and we realized we had a lot in common, and we got to really hang out a ton. We had to go to Walmart together to get props for me to pull out out of his ass. And I mean, we just had so much fun doing these things. It was really fun. And the first night I got to hang out with Vinny. We went to Fremont Street, and it was 3:00 our time. It was midnight there. And he was like, I'm hungry. And we looked at the street pizza. It was like, oh, hell no.
Oh, no.
So we ended up going to Denny's, which people were like, Denny's, why would you go to Denny's? It was awesome.
Denny's is great. Yeah.
It was a classic Las Vegas kind of going to a crappy diner with the drunks and the streetwalkers and all that stuff. It was cool as hell.
Mm-hmm.
And it was very well run because they know what they're doing at this place,
Oh,
because they have to deal with lunatics all the time. So I enjoyed hanging out with Vinny and the whole WATP crew except Chris, and Andy couldn't come. But we got to play Dabble Dice. I played Dabble Dice with Lucy Tightbox and Baloney Factory.
No.
And we played it in the casino. And that was sort of weird. We're in the casino sitting at a table. I'm pulling out these dice. And what I really wanted to do, because they've got like pictures of beer and then like liver. It's a game. I'll tell you more about the game later. And then splats, like if you fall down. So you're trying to collect 13 beers, but they're little 20 millimeter dice, right? So how much fun would it be to go to the craps table and swap out? Because I was a magician, I could do a dice swap easy and swap
a dice swap.
and then throw out these stupid Dabble dice. But anyway, see, this is the problem. I can't debrief with these two fucking knuckleheads.
Nope.
Because
Lord and Lady douchebag.
But anyway, we had a wonderful time. And we got to recreate the birth of Tukey. And I won't bother to tell you how that works, but just go watch it on DB Dabblers
Surely we can watch
Network.
Yeah, we'll watch it.
Dude, same. Lifelong friends. And then he ended up in the hospital. He was sick the whole time, never told me. I just thought he was stressed out because I noticed that he just had that look on his face, but I just thought he was stressed out because every single show wanted Tukey on it. Ray DeVito show wanted Tukey. WATP wanted Tukey. Melton wanted Tukey. And by the way, meeting Patrick Melton, I will say that I had some trepidation just meeting with him because he has this reputation on the nicest guy in the world. The big giant dude. And he was running that thing. He ran a great event. There were a lot of technical problems in the beginning. Vinny and Rocco and Carl and I kind of and a couple other people pitched in to get the monitors working and all that. But that was fun because, I did that. I used to do telethons. It's nothing. And it was really kind of fun to do. And Patrick was really grateful. He gave us all shout outs from the stage. And, he couldn't have been a more gracious host. So, and then they had a poker tournament the next day, which I was flying home at that point. And, that's the thing. I had to fly home at 6, right? So they were going to pick me up at 4. Well, the event was over at midnight, which is 3:00 our time. And by the time we got back to the hotel, it was 1:30. And then, people want to play Dabble Dice. And so I wanted people to play Dabble Dice. And so at 2:00, I'm like, well, why even go to bed? I have to get up at 3 to get, so I just stayed up. So I stayed up. And now listen, I'm too old for this shit, to go from 10 in the morning our time to midnight the next day was when I went to bed. It was 36 hours almost.
Jeez.
Yeah. So it was sort of ridiculous.
Yeah.
But we had a blast. Hackamainia was awesome. DabbleCon 2 is coming in August. Don't miss that. I'm going to start now. I have to I'm too old. I can't hang anymore. But although I will say at 68, there were people half my age going, I'm tired. And I'm like, no, we're going to,
we're going to play
it's
dice.
time, right. But anyway, I think I'm going to go to the major events. I'm going to go to DabbleCon, and if they do Hackamainia again, I'll do those. And I'm going to skip the regular live events because, well, we have so much other stuff going on with this show and Dave Landau stuff and all of that. And Alex Stein said that he was going to reach out this week and wants to get me over there to talk to him, probably to argue about vaccines. So that'll be fun. Anyway, thank you for the super chat, Bedabbler. Catalano TV got to hang out with Joey C and his lovely wife Christina. They were lovely, the king and queen of Hackamainia. And unfortunately, I think Joey got ill and wasn't able to hang for the second night, but it was really fun seeing them. And it was his lovely wife. She really just they're just very sweet, nice people. And people get these impressions. They have a certain persona on their shows and stuff, and then that is not how they are in real life. And but anyway, it was great. Myrtle Manus gifted 10 Weird Medicine Dr. Steve memberships. So please turn on your gifted memberships. These two are just fading fast. So let's get out of here.
It's 3,000 degrees in here.
All right.
I'll give you $100 to turn on the air conditioner while you're talking.
All right. Well, thanks. Always go to Dr. Scott. Tacey, thanks to everyone who's made this show happen over the years. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7, Sunday at 6, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.
All right, let's real quick do the opening, and then Tacey, you can get out of here. All right, here we go.